Hello everyone, today we're going to be doing an hCG urine test, also known as pregnancy test. Here's my little box, my urine from my patient, and the actual test. We're going to open this. Here's a little pregnancy test. This as well. So usually on pregnancy tests, it has like a little right here. Do you see it? That's how much urine it needs. Don't go over or less than, or not. It's not going to have an accurate reading. So we're going to open this up. You see? Perfect. Right there. And then all of it in here. And it's going to absorb it. And then all these little boxes with the hCG test, it has like little instructions. So 2 lines is a positive, 1 line is a negative. Where the C is, where the T is invalid.
And then it's a total wait time of 3 minutes for this specific pregnancy test.
So we're looking, it's already reading it.
You can already see it's past the T, so it looks like we're gonna have a good pregnancy test. And you can already see 1 line forming at the C. So it looks like we might be getting a negative pregnancy test, but you would have to wait until the full 3 minutes are over before you know the results.
Sometimes positive tests can come like right at the 3-minute mark.
So it's always best to wait the correct allotted time.
All right.
But I hope that explains everything for you guys.
Thank you.